Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with an April 1st, 2021 update from the Dubuque County Public Health Incident Management Team. Dubuque County's COVID-19 new case trend line keeps pointing upward with 119 cases reported in the last 7 days. And this number of new cases has been increasing for the past few weeks. In fact, Dubuque County is now considered a red zone, meaning high community transmission, and is an emerging hotspot, as stated in the latest community profile report from the White House COVID-19 team. Any way you look at it, we're going in the wrong direction. Over the past month, 30% of the new cases in Dubuque County have been in those aged 15 to 29, and 38% of the cases are occurring in those aged 0 to 29 years old. And these are the age groups that have had the fewest amount of vaccinations so far. But that's about to change because Monday, April 5th, vaccinations will be open to all those 16 years and older with no criteria for age or underlying health conditions. Oh, wait, you don't think you need a COVID-19 vaccine because you feel great, are young, and even if you get infected, you don't think it's a big deal? Let me clarify a few things. First of all, this virus can affect people differently. And yes, young people are being hospitalized with severe illness. Not to mention, the B.1.1.7 variant, which is becoming more prevalent in Iowa, is more contagious and can be passed from person to person more easily. Finally, remember the 10% of COVID infections that are becoming long haulers, which also includes young adults. Do you really want to risk having breathing difficulty, fatigue, and a multitude of other symptoms following COVID-19 illness? Trust me, it's not worth the risk. It's clear the benefits of any of the vaccines available far outweigh the risks or any side effects that only last for a day or two. Vaccinations in Dubuque County continue with some increase in doses available, and this will continue through April and May. We will be prioritizing essential workers and those who have underlying health conditions for the next couple of weeks. But as supplies continue to increase, everyone will have more access to a COVID-19 shot, either through your healthcare provider or at a pharmacy or an open clinic. And because vaccine supplies are still limited, you won't get to choose which vaccine you receive. If you want that choice, you'll just have to wait. I'm not going to pull any April Fool's pranks on you today, neither is Google for that matter, and that's the second year in a row Google has canceled April Fool's Day. My message is simply the pandemic is far from over, plain and simple, and that's no prank. This weekend is a holiday weekend for those celebrating Easter, and many will be gathering to celebrate the spring weather, which means family and friends will want to gather for traditional celebrations, including meals, religious services, and Easter egg hunts. So with your get-togethers, outdoor activities are the safest. Because everyone is not fully vaccinated, especially children, continue to avoid crowds and indoor spaces that do not offer fresh air from the outdoors. If you're together in the indoors, bring in fresh air by opening windows and doors. Better yet, limit the number of guests. And let's not forget wearing a mask correctly and consistently. Remember that people without symptoms or even with a recent negative test result can still spread COVID-19 to others. I'm sure no one wants to unknowingly give COVID-19 to an elderly friend, parent, or relative. Luckily, this weekend, the temperatures will be warm enough to open up the windows a little. So whether you're hunting for eggs or watching the Final Four, let's not let our guard down. We've come this far. Recall the increased number of cases this past couple of weeks and continue to be safe, all of us together. Have a great weekend, everyone.